Hello everyone, I am Dr. Mahalakshmi, educator, forensic medicine and toxicology. Now in this video, we are going to see agriculture poisoning. So agriculture poisoning, it is the most commonest poisoning that we expect to see in our country. Our country is an agriculture nation and we use all sort of agriculture products. Like we use fertilizers, we use pesticides, insecticides, everything we use, and each and every component can be a potential poison. So this agriculture poison, it is very important in practical aspect, and for theory exam also you will be getting OPC. You will be getting some sort of agriculture poisoning, and frequently you get OPC from this topic, which is very high yield. Now we will first see like what are the agriculture poison that you can come across. The first thing you will be getting is fertilizers. So fertilizer components, mostly ammonia and nitrogen compounds like nitrites, you will be getting these, and this is kind of like rare, but the most commonest that you can come across is pesticide. Even in pesticide you will be getting this organophosphorus. This is the most common, you will be getting organophosphorus. Then you can also get organochlorides and carbamate. These are the most commonest thing that you can expect to see in the pesticide and insecticide category. Then coming to the grain preservatives, this is also common in few part of the country. You will be getting with aluminium phosphide. Grain preservative aluminium phosphide, most commonly known as Celphos. You will be getting a tablet. This is put in the godown to prevent the grain from infested by any like rat or something, or to prevent from any fungicides. Okay. So this grain preservative is also very common. Apart from that, you can expect weedicide, something that you will use to destroy all the small weeds in the. So this weed you have paraquat. You can also have fungicides like your heavy metal, zinc, copper, everything is used as a fungicide. From that also you can expect to see poisoning. So these are the most commonest agriculture poison that you can expect to see, and amongst this, these are very important. All these, they are potential questions, and this is what we are going to see in this chapter. First we are starting with organophosphorus compounds. So these organophosphorus compounds, these are the most common pesticides that we are using, and they has these peculiar kerosene smell. And these organophosphorus compounds, they are broadly divided into alkyl OP and aryl OP. So you get alkyl organophosphorus compounds and aryl organophosphorus compounds, and the difference between these two is this aryl, they need activation by liver. They need activation by liver, and alkyl, they can directly act. So they don't need any sort of activation. They will start acting directly and it will lead to the poisonous activity. And what does this OPC do is, like initially this OPC, it was used in the World War. There it was used as a war gas, but later on they got to know that it can be used as a pesticide to kill all the pests and unwanted insects in the field. So they started using this OPC, and now we are using this widely in our country. So how it happens is that, how the poisoning happens is that, like it is an acetylcholinesterase inhibitor. What it will do is, normally this is how the pathway. So this is your synapse junction, you have the acetylcholine. See, acetylcholine is released, it will go sit in the receptor and the transmission will happen. This is how it is normally done. And once the transmission is over, acetylcholinesterases, they will come and pick up the acetylcholine and degrade them so that the transmission will stop. So the transmission will stop. But now what this OPC will do is that they will go. So this red color thing is your OPC. What they will do is, they will go attached to the acetylcholinesterases and they will prevent the IACH, acetylcholine, from attaching to this acetylcholinesterases. Because of that, acetylcholinesterase activity will be inhibited. So you get acetylcholinesterases inhibition. So this activity will be inhibited, and you will be getting continuous stimulation. There will be continuous transmission of neurotransmitter and signals. Because of that, you will have overactivity of the nicotinic receptors and also your muscarinic receptors. So, acetylcholine, it is normally taken away from the junction by acetylcholinesterases. But this OP components, what they will do is, they will go attached to this acetylcholinesterases and inhibit them. Because of that, there will be surplus supply of acetylcholine, which will cause continuous transmission, and all the activity via nicotinic and muscarinic receptors will keep on happening. And because of that, you will be experiencing the symptoms. So, you get muscarinic symptoms through dumbbell and nicotinic symptoms through match. So, this is nicotinic symptoms. So, what happens is that here you will have increased secretion, everything will be increased, all the secretion will be increased. You will have diarrhea, you will have urination, you will have meiosis, you will have bronchoria, bronchospasm, then you have emesis, then you have lacrimation and salivation. So, all the secretions, it will be increased. Any sort of secretion that happens in your body will be increased by this acetylcholine. So, this acetylcholine, it will increase all the secretion and you will get all these. So, these are the common symptoms with which the people will come to you. And sometimes in lacrimation, you can also see red tears. So, there will be red color tears also in this OPC poisoning. So, muscarinic symptom, it will increase the secretion. Now, nicotinic symptom, what it will do is, it mainly acts in the nervous system. What it can do is, it will cause muscle tremor, ataxia, chorea, hypertension. So, all this it will be seen in this nicotinic symptoms. Muscarinic, all increased secretion. Nicotinic, mostly neurological symptoms you will be experiencing. And so, how you will diagnose? The diagnosis for this OPC is mainly cholinesterase estimation. You will look for the quantity of the cholinesterases. This is the most important test. And RBC cholinesterase, they are more reliable. The level of the RBC cholinesterase level, it is more reliable. Like you have lot of cholinesterases in your body. You get neuronal cholinesterase, you get neuronal cholinesterase, you get plasma cholinesterase. So, all these esterases will be present in your body. In all sort of cell, you will have different types of cholinesterases, and all the cholinesterases will be inhibited by your OPC component. So, here if you measure this RBC cholinesterases, it will be highly reliable. And because of this neuronal cholinesterase inhibition, you will be getting lot neurological symptoms. And this is more prominent in chronic poisoning with OPC. When there is chronic exposure to OPC, you will be getting these neurological symptoms. So, this is about cholinesterase diagnosis. Then you can also do nitrophenol test and thin layer chromatography for diagnosis. So, mainly it is cholinesterase quantification. Apart from that, you can do this thin layer chromatography and nitrophenol test. Now, you have one more thing known as intermediary syndrome. So, what is intermediary syndrome? What is this? Like usually, you will give the treatment. So, the treatment for this is that the treatment is mainly airway securing, oxygen. This is the mode of treatment for this OPC component. Like there will be bronchorrhea, increased bronchial secretion and bronchospasm. So you have to combat that and you have to give oxygen and secure the airway. This is the first line of management. After that, you have to give atropine, which will counteract the muscarinic symptoms. So this atropine which will counteract the muscarinic symptoms. Now another thing that you have to give is oximes. These oximes are very specific and it will also counteract nicotinic symptoms. So your oximes, it will counteract nicotinic symptoms, and this is the main mode of treatment for this. Now what will happen is that if you don't give the treatment properly, if there is any residual, because this OPC, they will go deposit in the adipose tissue. In the adipose tissue, it has more affinity and it will go deposit there. If the treatment is not adequate, what will happen? These adipose tissue, they will start releasing this OPC after few days. After few days, OPC will be released and you will get the same symptoms. You will get the same symptoms again. And here you will be getting facial muscle weakness. Weakness of respiratory muscle. This is the main modality of presentation. So this is how it will present in all the cases. And here the treatment is symptomatic. You need not give oxime or atropine again. It is completely symptomatic, but if it is not treated, they can go to respiratory arrest also. So that is also there. So this is about this intermediate syndrome. Now if you don't give enough treatment, this can happen. But if you give delayed treatment, there is something known as aging. So aging phenomenon will happen. So here what will happen is that, so when you don't treat adequately, you will get this intermediate syndrome. And if you start the treatment later, you will get something known as aging phenomenon. So here what will happen is that when you start the oximes later, oxime are given later, what will happen? By that time, the acetylcholinesterase plus OPC complex, it will become very stable. So oximes cannot break this. It cannot break this complex. So this is what aging is known as. If you give oximes later on, even if you give oxime, there will not be enough effect seen. So that is why you have to start oximes as early as possible. So these are the two important things we have to know in OPC. One is intermediate syndrome, another is aging phenomenon. Now, what happens in the postmortem appearance, how it will look like, that is very important. So all the cases of OPC, you will have this OPC smell, which is kerosene smell. This kerosene smell is very, very important. It will be present in most of the cases. And apart from this kerosene smell, you will also get to see asphyxia-like feature. You will be seeing petechiae, cyanosis. All this will be seen, and in the stomach, you will be able to see congested mucosa, and all internal organs will be congested. All the internal organs would be congested. Along with that, you will be able to see petechiae in heart. This is the postmortem appearance of a OPC poisoning case. So all these things will be seen in a case of OPC poisoning. So OPC, it is a pesticide. It has two groups, alkyl and aryl groups. And what is the mechanism of action? they will go inhibit acetylcholinesterase. Because of that, there will be continuous stimulation of nicotinic and muscarinic receptors, and because of that you will be getting increased secretion. And how will you diagnose that? You will be quantifying the acetylcholinesterase level, and you will also do nitrophenol test or thin layer chromatography. So you have seen the presentation, diagnosis, now treatment. For treatment, you have to mainly secure the airway, give oxygen to counteract the bronchoria and bronchospasm. Then you can give atropine and oxime as antidote. And this oxime, if you give later on, the cholinesterases and OPC complex will be becoming unbreakable, which we call as aging phenomenon. So we have to start oxime as soon as possible, otherwise it is no use. And if you don't treat the patient adequately, the OPC will go settle down in the adipose tissue, and after few days it will come back again into the system, causing the same toxicity, where you will be getting muscular weakness along with respiratory depression. And main mode of treatment here is symptomatic, no need to start atropine or oximes. Postmortem appearance, you will get the kerosene smell, congestion of the stomach and other internal organs, petechiae in the heart and all over the body, you will be getting the cyanosis. So this is the important aspect about OPC. Now what we are going to see is carbamates. So this carbamates, it is similar to OPC. In all aspects, the mechanism of action, absorption, everything is similar to OPC. It is also absorbed through skin. Like OPC, it is absorbed through skin also. Both the things, it will be absorbed easily, and its mechanism of action, it is similar to OPC. The main thing is that it is having less severe action. So the severity will be much less when compared to the OPC. And most important thing when you come across carbamate is that treatment. Oximes are contraindicated. So the main thing is you do not give oxime. Why? Because this oxime and carbamate, this complex, it is very, very dangerous. This is more poisonous than your oxime and acetylcholinesterase. So this is highly poisonous. So because of that, you don't give oximes and carbamates. Everything else is similar to OPC except for this one thing, that is contraindication of oximes. That is why carbamates you do not give oximes. Clear? So we have seen OPC and we have seen the little brother of OPC, that is carbamate. Now what we are going to see is organochlorine. So this is organochlorine. So this organochlorine, this is a non-selective insecticide. So what happened was that this insecticide, it was introduced and it was used to kill all the insects, and it was very, very famous. Everybody was using it, but later on they came to know that it is very, very toxic to the ground, and it is having lot of toxicity when left in the food also. So it is having lot of residues, and because of that there is lot of toxicity happening to people also, and it was killing all the insects that are doing us good also getting killed because of this. So because we have restricted this usage, we have restricted usage of this organochlorine. Since it is a non-selective insecticide, we don't use it except for DDT and Endrain. DDT and Endrain. These are also under very severe restriction only it is being used, and it is absorbed through all routes. But absorption is very slow. You have slow absorption. And it is metabolized in the liver and through enterohepatic circulation it is excreted. So what it will do is that when it is absorbed into the body, it will cause opening of neuronal sodium channels. So neuronal sodium channels, it will be opened by this. So because of this there will be continuous influx and continuous stimulation, and there will be mostly you will be getting all the neurological symptoms. You have myoclonus, tremor, seizure, hyperthermia, respiratory failure and death. So because of this continuous influx of ions, you will be getting constant stimulation and neurotransmission, which will result in all the symptoms. So like most commonly what will happen is that this organochlorine compounds, it is used for killing parasites. So for killing parasites, it is used in very less concentration in topical application. For topical application, we use them as a shampoo or sometimes as a ointment it will be used, and through that it will get absorbed and people may get seizure. So this is usually contraindicated even in children. Okay. So this parasite infestation also, we don't use this unless until it is compulsory. So all these symptoms you will be getting in this poisoning, and the main method of this decontamination. So main method of treatment is decontamination. There is no specific antidote. No specific antidote. All the management should be done symptomatically, and contraindication is adrenaline. You should not give adrenaline because it will lead to myocardial degeneration in this. So organochlorine you mainly do symptomatic management, but adrenaline is contraindicated, and it can also lead to hepatic toxicity. Since the metabolism and excretion everything is via this enterohepatic circulation, it can lead to severe hepatic toxicity also. And in postmortem, one of the striking features is centrilobar hepatic necrosis. This is the main thing you will be seeing. Along with it, you will be also seeing the asphyxial features. Asphyxial features in the postmortem appearances. So organochlorine is entirely different from organophosphorus. So organophosphorus, it was acting with the acetylcholinesterases. Organochlorines, it is opening up the neuronal sodium channels, resulting in constant stimulation, leading to tremor and convulsion and respiratory failure, death. So organochlorines, there is no specific treatment, only symptomatic treatment is done, and it can lead to hepatic failure also, since it is mainly excreted via enterohepatic circulation. So this is about insecticides. Now what we are going to see is Celphos, which is a grain preservative. So usually you will get tablets like this. These are Celphos tablets. Actually the component here is aluminium phosphide. This is the component. They will use one or few tablets and they will put it in the godown where the grain is usually stored. And if any mice or any other pest comes, it will eat those tablets and they will die. And it will not give any residue in the grain, and grain will be unaffected. So that is the principle behind this. People were using it since it is very cheap and easily available, and it is not toxic. It is not leaving any toxic residue in the grains. That is why it was used. But what happens is that when this aluminium phosphide, it is exposed to moisture. When it is exposed to moisture, it will start releasing phosphine gas. So there will be release of phosphine gas, which is highly toxic. So this phosphine gas is something that leads to all the toxicity. So if it is consumed, you will be having erosions and even strictures will be formed in the later period. And lung, because of this phosphine gas, you will have severe pulmonary edema and dyspnea. In liver, you can get necrosis. And heart, there will be depression and cardiotoxicity. At cellular level, it prevents mitochondrial oxygen uptake. So it prevents oxygen uptake. And it has this peculiar garlic odor. So this is the normal presentation. When you consume it, there will be local corrosive action. So you will have the esophageal erosions and stomach mucosa erosions, and it will cause damage to the liver, lung and heart. Multiple organs will get damaged because of this phosphine gas, and even at cellular level there will be inhibition of mitochondrial oxygen uptake. So these are the problem with this Celphos, and this is commonly presented as like when they open the ground, there will be some people like working or playing near the ground, and when they suddenly open the ground after a long time, this gas will come, and because of the moisture the people will get the gas and they will get affected. So this is the Celphos poisoning, and the main mode of treatment here is magnesium sulfate and symptomatic treatment. So magnesium sulfate is one important antidote that you give in this aluminium phosphide. It reduces the mortality by almost 50%. It will reduce the mortality. And for diagnosis, we use this silver nitrate test. What they will do is, they will put silver nitrate in a paper, and they will put it over the mouth and nose of the patient who has consumed this aluminium phosphide. If phosphine is present in their system, this paper containing silver nitrate will turn brown. So in presence of phosphine, this will become brown. So by looking at this, they will come to a diagnosis that okay, this is a case of aluminium phosphide poisoning. So they will suspect that, and also there will be increased level of liver function test like SGOT, SGPT, everything will be increased. And in the postmortem period, the postmortem appearances what you can expect here is, postmortem we can mainly see garlic odor, can get to see garlic odor, then you can see hepatic necrosis, renal tubular necrosis, and gastric mucosal congestion. So the main important thing while doing PM is that these people, they will keep on emitting the phosphine gas even after death. So you have to be precautious while doing autopsy in them. You have to make sure that you are not standing too close to the body. So that is one important aspect of this aluminium phosphide poisoning. So it is known as Celphos. Even 1 to 2 tablet is highly poisonous, and the poisonous activity is mainly due to release of the phosphine gas, which can cause multi-organ dysfunction and lead to death. So this is about grain preservative. Next what we are seeing is Paraquat, which is a weedicide. Like all the small weeds, it will remove the weeds. Now what is the mechanism of action is that it will cause free radical production, which will result in the severe lung damage. So it has this pneumotropism. It will go accumulate in the lung, and there will be severe pulmonary edema and pulmonary hemorrhage. And at the mitochondrial level, it will inhibit the mitochondrial oxygen uptake. Okay, so it will affect mitochondria also. So mitochondria, there will be issue, and liver and kidney both will be affected. There will be dysfunction of liver and kidney, and in the CNS it will lead to depression. There will be severe depression of brain activity. So this Paraquat, mainly by causing free radical protection, it will lead to all these changes. Apart from that, it also has corrosive action. Corrosive action, because of that you will get all these erosions in the oral mucosa, and it will also lead to membrane formation. Membrane formation in pharynx. So this is known as diphtheria-like pseudomembrane. This is very typically seen in this Paraquat poisoning. So first you think because of this corrosion, you will be getting erosion of the oral mucosa, and in pharynx you will be getting pseudomembrane formation, and because of this pneumotropism, in lung you will be getting severe pulmonary edema and hemorrhage, and it will cause damage to kidney, liver and CNS depression. Everything due to the free radical protection. And in postmortem appearances, the most striking feature would be pulmonary edema. You will get massive pulmonary edema, and all these GI irritant features you will be seeing. So this is about paraquat. So paraquat mainly it is a weedicide. It has this pneumotropism. It causes damage by free radical protection and it also causes pseudomembrane like diphtheria. So this is the important agriculture poison that we have to know, starting from OPC, carbamate, organochlorine, aluminium phosphide and paraquat. These are the most important agriculture poisoning everyone must know, and it is a very important exam topic. Thank you for watching.